Do you ever feel a strange tingling in your hands or feet, like pins and needles that just won't go away? Or maybe your fingers feel numb when you wake up in the morning and you just brush it off, thinking it's normal aging. Here's what most people don't know. That tingling, that numbness, that burning sensation in your legs, it might not just be getting older. It could be your nerves quietly crying out for one specific vitamin that most people over 60 are dangerously low in. And the shocking part, your doctor may never even mention it. Stay with me, because what you're about to hear in the next few minutes could genuinely change your life. Welcome back. And if you're new here, welcome. This channel is dedicated to helping seniors live longer, healthier, and more vibrant lives. Today, we're diving deep into something that affects tens of millions of people over the age of 60 across the United States, and most of them have absolutely no idea it's happening to them. We're talking about nerve damage, also called peripheral neuropathy. And more importantly, we're talking about the one powerful daily vitamin that science says could help restore nerve health, often faster than people expect. This vitamin is affordable. It's available at any pharmacy. And yet, most seniors are severely deficient in it. So, whether you're personally dealing with numbness, tingling, weakness, or balance problems, or you're watching this to protect a parent, a spouse, or a loved one, please watch this entire video, because this information could genuinely make a life-changing difference. Let's get into it. First, let's understand what's actually going on inside your body. Your nervous system is like the electrical wiring of a house. It carries signals from your brain to every single part of your body, your fingers, your toes, your muscles, your organs, everything. Now, surrounding each nerve is a protective coating called the myelin sheath. Think of it like the rubber insulation around an electrical wire. It protects the nerve and helps signals travel fast and accurately. But here's the problem. As we age, that protective coating begins to break down. And when it does, nerves can't communicate properly. Signals get scrambled. Some don't get through at all. The result? You might feel that familiar tingling or burning in your hands and feet. You might experience numbness, like parts of your body are asleep even when they shouldn't be. You might notice muscle weakness, trouble with balance, or even unexplained fatigue. Some seniors describe it as walking on cotton wool, a strange disconnect between their feet and the ground. Does any of that sound familiar? If it does, you are not alone. Over 20 million Americans are estimated to suffer from some form of peripheral neuropathy, and the risk goes up dramatically after the age of 60. But here's the most important thing I want you to hear today. This is not always permanent, and it is not always inevitable. In many cases, the root cause comes down to a single, correctable deficiency. So what is this vitamin? It's vitamin B12, also known as cobalamin, and I know what some of you might be thinking. Oh, B12, I've heard of that. But stay with me, because most people massively underestimate just how critical this vitamin is, and just how devastating it is to be without it. Vitamin B12 is the single most important nutrient for your nervous system. Here's why. Remember that myelin sheath, the protective coating around your nerves that we just talked about? Your body cannot make or maintain it without vitamin B12. Without adequate B12, that sheath deteriorates. Nerves become exposed and damaged. And over time, the damage can become severe. B12 also plays a critical role in producing red blood cells, supporting brain function, maintaining DNA, and keeping your energy levels stable. In short, B12 is not optional. Your body needs it every single day. And here's the alarming truth. Research suggests that up to 20% of adults over 60 are deficient in vitamin B12. Some studies put that number even higher. And the scary part? Many people don't even know they're deficient until serious symptoms appear. You might be wondering, why is B12 deficiency so common in older adults specifically? Great question. And the answer comes down to absorption. When you're young, your stomach produces plenty of a substance called intrinsic factor, a special protein that helps your body absorb B12 from the food you eat. But as you get older, your stomach naturally produces less stomach acid and less intrinsic factor. That means even if you're eating foods rich in B12, like meat, fish, eggs, and dairy, your body may not be absorbing nearly enough of it. This is why diet alone often isn't enough for seniors. There are also other risk factors that make deficiency even more likely. First, medications. If you take metformin for diabetes, this is hugely important. Studies show that long-term use of metformin significantly depletes B12 levels. And if you regularly take proton pump inhibitors, those are acid reflux medications like omeprazole or Nexium. Those also interfere with B12 absorption. Second, a plant-based or limited diet. B12 is found almost exclusively in animal products. Seniors who eat less meat or who follow vegetarian or vegan diets are at significantly higher risk. Third, gastrointestinal conditions. Conditions like Crohn's disease, celiac disease, or even previous stomach surgeries can dramatically reduce B12 absorption. And fourth, alcohol consumption. Even moderate, regular alcohol use can interfere with how your body processes and absorbs B12. So if any of those apply to you or someone you love, please pay close attention to what comes next. Now let's talk about the warning signs. Because B12 deficiency doesn't announce itself loudly, it creeps in slowly, and many seniors mistake the symptoms for just getting older. Please don't make that mistake. Warning sign number 1, tingling or numbness. That pins and needles feeling in your hands, feet, or legs. It might come and go at first. Many seniors ignore this for months or even years. Please don't. Warning sign number 2, balance problems and falls. B12 deficiency directly affects your spinal cord and the nerves that control coordination. If you've noticed yourself feeling unsteady, stumbling, or having more falls, B12 could be playing a major role. And here's something important to know. Falls are the leading cause of injury in adults over 65 in the United States, and nerve damage is a major contributing factor. Warning. Sign number 3, memory problems and brain fog. Feeling forgetful, struggling to concentrate, having trouble finding words? B12 deficiency can cause cognitive decline that closely mimics early dementia. In fact, there are documented cases of seniors who were diagnosed with dementia, whose symptoms dramatically improved once their B12 levels were properly corrected. Warning sign number 4, extreme fatigue and weakness. Not regular tiredness, but a deep, bone-level exhaustion that sleep doesn't fix. Without B12, your body can't produce healthy red blood cells, leading to a condition called megaloblastic anemia, which causes profound, persistent fatigue. Warning, sign number 5, pale or yellowish skin. When red blood cells are affected, it can cause a pale or slightly yellow tint to the skin. If you've noticed this in yourself or a loved one, it's worth discussing with your doctor. Warning sign, number 6, a sore, swollen, or inflamed tongue. This one surprises a lot of people. A glossy, swollen, or painful tongue, sometimes called glossitis, is a well-recognized sign of B12 deficiency. Warning sign number 7, mood changes, depression, and anxiety. B12 is directly involved in producing mood-regulating chemicals in the brain, including serotonin and dopamine. Low B12 has been strongly linked to depression and irritability in older adults. Now, here's what's critically important. These symptoms can appear even before your blood test shows a deficiency. Standard blood tests often use ranges that are too low, and many doctors miss borderline cases entirely. If you're experiencing several of these symptoms, advocate for yourself. Ask your doctor specifically about your B12 levels, and ask whether your level is truly optimal, not just normal. I want to stop here for just a moment. If you're over 60, or if you're watching this because you care for an elderly parent, a spouse, or a loved one, this information could genuinely be life-saving. B12 deficiency is one of the most underdiagnosed and overlooked conditions in senior healthcare today, and unlike so many health problems, this one is fixable. So please, stay with me for the rest of this video, and if this resonates with you, do me a favor right now. Drop a comment below. Tell me, have you or someone you love ever experienced any of these symptoms? Your comment might help someone else watching feel less alone. Okay, let's keep going. So here's where the real good news comes in. When B12 levels are restored, especially in the early to moderate stages of deficiency, the results can be remarkable. Research has shown that with proper B12 supplementation, nerve regeneration can begin. The myelin sheath has the ability to repair itself when it finally receives the nutrients it needs. It's not instant, but it is possible. Tingling and numbness often improve significantly within weeks to months of supplementation. Balance and coordination can improve, reducing fall risk. Cognitive symptoms, the brain fog, the forgetfulness, can often reverse, especially when caught early. And mood and energy levels frequently improve dramatically. One important note: the sooner deficiency is addressed, the better. Nerve damage that has been present for many years may be harder to fully reverse. This is why catching it early is so essential. But even in cases of longer-standing deficiency, supplementation can often stop further damage and provide meaningful symptom relief. So, what should you actually do? Let's talk about the practical steps. Step 1. Get your levels tested. The first thing to do is ask your doctor for a serum B12 blood test. It's simple, inexpensive, and can be done at any routine checkup. Ask for your specific number. Many experts suggest that optimal B12 levels for seniors should be above 400 to 500 picograms per milliliter, even though many labs list normal as anything above 200. There is a meaningful difference between technically normal and truly optimal. Step 2. Choose the right form of B12. Not all B12 supplements are created equal, especially for seniors. Because absorption through the stomach is often the problem, sublingual B12, tablets that dissolve under your tongue, bypass the digestive system and go directly into your bloodstream. This form is often highly effective for older adults. Methylcobalamin is generally considered the most bioavailable and easily used form of B12 by the body. Look for this word on supplement labels. For severe deficiencies, doctors may recommend B12 injections, which completely bypass the digestive system and deliver the vitamin directly. These are very effective and are covered by Medicare in many cases. Step 3. Know your dosage. For seniors, doses of 500 to 1,000 micrograms daily of sublingual B12 are commonly recommended. But always consult your own doctor or healthcare provider for personalized guidance based on your individual health history and lab results. Step 4. Be consistent. B12 is not a one-time fix. It works best as a daily habit, consistently taken over weeks and months. Give your body time to rebuild its stores. Step 5. Combine with other B vitamins. B12 works best in partnership with other B vitamins, particularly vitamin B6 and folate, also known as B9. These three work together to protect nerves and support brain health. Many high-quality B-complex supplements include all three. Beyond supplementation, there are several powerful lifestyle steps that can work alongside B12 to support your nerve health. Tip number 1. Eat B12-rich foods every single day. That means lean beef, chicken, and turkey, salmon, tuna, sardines, and trout, eggs, especially the yolk, low-fat dairy products like milk and yogurt, and for those eating less meat, fortified cereals and nutritional yeast are excellent options. Tip number 2, stay physically active. Gentle exercise, walking, swimming, tai chi, light stretching, improves circulation, which helps deliver vital nutrients to your nerves. Even 20 to 30 minutes of gentle movement daily can make a meaningful difference. And Tai Chi in particular has been shown in multiple studies to significantly improve balance and reduce fall risk in seniors. Tip number 3, manage your blood sugar carefully. High blood sugar is one of the most damaging forces to nerves in the body. If you have diabetes or pre-diabetes, working closely with your doctor to manage your glucose levels is absolutely essential for nerve health. Tip number 4, limit alcohol. Even moderate drinking can worsen nerve damage and interfere with B12 absorption. If nerve health is a concern, speak honestly with your doctor about your alcohol intake. Tip number 5, stay hydrated. Dehydration affects nerve function more than most people realize. Aim for 6 to 8 glasses of water daily, unless your doctor has advised otherwise. Tip number 6. Prioritize sleep. Nerve repair and regeneration largely happen during deep sleep. Getting 7 to 9 hours of quality sleep is not a luxury for seniors. It is a biological necessity. Tip number 7. Review your medications with your doctor. If you take metformin or acid-reducing medications long-term, have an honest conversation with your doctor about whether B12 monitoring and supplementation should be part of your routine care. This is a well-established medical concern, and any good doctor will take it seriously. I also want to speak directly to the family members and caregivers watching this. If you have a parent, spouse, or loved one over 60 who seems more forgetful lately, who's been falling more often, who complains of numbness in their feet, who seems more tired or depressed than usual, please don't dismiss these things as just old age. Bring up B12 at their next doctor's appointment. Gently advocate for testing. Share this video with them. So many seniors suffer in silence, not because there's no solution, but because no one connected the dots. You could be the person who changes that for someone you love. Let me bring everything together for you. After the age of 60, your body's ability to absorb vitamin B12 naturally decreases. And without sufficient B12, the protective sheath around your nerves begins to break down, leading to tingling, numbness, weakness, balance problems, brain fog, fatigue, and mood changes. The good news? In many cases, this is not permanent, and it is not inevitable. With proper testing, targeted supplementation, and smart lifestyle choices, many seniors experience real, meaningful improvement in their nerve health, sometimes within just weeks. Here's your action plan starting today. Talk to your doctor about a B12 blood test. Ask for your specific number, not just normal or fine. Consider sublingual methylcobalamin B12 supplementation. Incorporate B12-rich foods into your daily diet. Move your body gently every single day. Get quality sleep and stay well hydrated. And share this information with anyone over 60 that you care about. You deserve to feel strong. You deserve to feel steady on your feet. You deserve to think clearly, wake up energized, and live your life without chronic pain or numbness holding you back. Don't let a simple vitamin deficiency steal that from you. Your health is worth fighting for, at every age, and especially at this one. If this video gave you something valuable today, please give it a thumbs up. It helps more seniors find this information who truly need it. Subscribe to this channel if you haven't already. We publish new senior health content every week, covering everything from nutrition and medications to heart health, brain health, and longevity tips designed specifically for people over 60. And share this video with a family member or friend who might benefit. Sometimes one video at the right moment genuinely changes someone's life. I'd also love to hear from you. Drop a comment below and tell me, have you ever experienced tingling, numbness, or any of the symptoms we talked about today? Have you been tested for B12? Let's talk in the comments. This community is here for you. Until next time, take care of yourself, take care of each other, and remember, it is never too late to take control of your health.